దేశంలో కరోనా కేసులు వ్యాక్సినేషన్ కు సంబంధించి కేంద్ర ఆరోగ్య శాఖ అధికారులు మాట్లాడుతున్నారు. లైవ్ చూద్దాం.
Backup. The same licensure now applies to both the vaccines, so therefore it's a great day. This vaccine, as you know, has already been given to more than 19 lakh people, and it has stood the test of time in terms of great safety. Only 311 individuals had some minimal side effects. So this is a great news for the day. It is a triumph of India's research and development enterprise, science and technology enterprise, as well as our industry, and I congratulate the team in the laboratories of the Indian Council of Medical Research led by Dr. Bhargav himself, and of course the Bharat Biotech industry, which has ensured that the vaccine candidate was taken through all the stages of its development, all the difficult stages of development in the laboratory, in the animal laboratories, and then out in the field, where more than 25,000 individuals were randomized to receive the vaccine or the placebo. It's great work having been done by them. The further trial, phase 3, goes on, like for the other vaccines in the world as well as in India. But it is a great milestone on this day. The third point that I wish to make is a matter of concern. Rajesh Bhushanji has graphically demonstrated to you where the states where we have significant worry. We are very worried about Maharashtra. Across several districts of Maharashtra, you saw their names. And as we came in, we learned that there is a strict lockdown being imposed in Nagpur in particular. So we are reaching a situation where those approaches are being brought back. It's a very serious matter. It has two lessons for us. One, don't take the virus for granted. It can come up unexpectedly. It can come up when its own dynamics, part of which we don't know, favor the virus. And it also tells us that if we have to remain free of this virus with time, it is very important that all our armamentarium, COVID appropriate behavior, containment strategy, readiness from the health system point of view, our facilities, and so on and so forth, as well as vaccination today, has to be brought into facing this pandemic and the virus in full blast. For example, it will be our suggestion that in districts, in all the states where the virus is seemingly on the rise in a significant way, the vaccination of the eligible individuals in those areas should be intensified, should be prioritized, in fact. That will be our advice. I also want to bring in here a word of caution for the Delhi and neighborhood, that Delhi is also seeing somewhat of a rise, somewhat of increase in positivity rate. So also in Gurgaon, Hyderabad, as well as to an extent in Gautam Budh Nagar and Ghaziabad. Be careful, be watchful. We still have a huge population at risk of this virus. This pandemic is not yet over. Until it is fully over, it is not over. And therefore be vigilant, and today, using the force of vaccination, we are in a position to give a fight which is stronger than the fight that we gave thus far. So we plead yet again to all of us, all the individuals here, as well as those who are listening to us, do not lower your guard. Do not take this virus for granted. At the same time, please embrace the vaccines that are available. Please, if you are eligible, we want to cover you.